a pretty unique ladder. So I've been with the Hospital Association Southern California for 28 years, and it's been quite a ride. It's been one of those careers where every morning, there hasn't been a morning where I've woken up and said, I don't want to go to work. There's been mornings where, oh man, work is going to be awful today. We've had a lot of that over the past 3 years. But I've been there 28 years, and how I got there was a unique experience. I don't think too many people have this opportunity, but my dad was president and CEO for the Hospital Association. He worked there from 1958 to 2000, or 1994. He would not hire me, though. So I had to earn it on my own. I went around his back after he announced his retirement, talked to somebody else, and they said there was an opportunity. So I joined. It was our for-profit subsidiary at the time. Realized that's where there wasn't quite the same advocacy and things that I saw growing up and watching my dad work. There wasn't that hands-on helping hospitals navigate through the complexities of healthcare delivery systems. So I then went over to advocacy, and I've been doing something along policy lines or advocacy since 1990. We are a trade association for hospitals, all types of hospitals in Southern California, 6 counties: Los Angeles, Orange, San Bernardino, Riverside, Ventura, and Santa Barbara County. And we have 184 members, ranging from Cedars, Long Beach Memorial, down to Avalon out in Catalina, Bear Mountains up in Big Bear, and everything in between. We have about 97% of the market share, as we say. And we do policy and advocacy at the local level, so we're working with LA County EMS, county EMS agencies, County Department of Mental Health, Public Health, local Medi-Cal managed care plans, and then we are closely aligned with the California Hospital Association, which is in Sacramento doing work at the state and federal level. And so we really get into the weeds of healthcare policy and delivery system in Southern California. Well, the most exciting and the most tragic has been over the past 2.5 years through this pandemic. It's exacerbated so many problems that were already in existence. As a result of COVID, we've seen a significant increase in the number of behavioral and mental health patients coming to the emergency department. Sadly, a lot of those are pediatrics. And so we have a number of kids that are going to emergency departments on what's called the 5150 hold, which is a danger to themselves or others. And there are not enough beds to care for them, so they end up languishing in emergency departments. So we've been dealing with a behavioral health crisis for years, through my whole career. It continues to get worse. But there's never a dull moment in this business, especially on the advocacy side. Again, the tragedy around COVID, when it first hit, I was actually in line the day after Christmas of 2020, I believe it was, with my family. We were getting tested because the kids didn't feel well. At the same time, I'm on the phone with LA County EMS and our CEO, George Green, and others, trying to figure out how to navigate, how are we going to move patients through the system, because hospitals were already backing up. EMS providers weren't able to get enough ambulances out to pick up patients because so many of them were waiting in emergency departments. And that kind of tipped off what was going to be a significant issue. It was a disaster, and we have a great disaster response system in Southern California. But we deal with disasters like earthquakes and train wrecks and other things where it's a disaster. You go in, you respond, and then you also have flexibility within the system to spread patients out. But during that part of COVID, we were not able to, there was no mutual aid. Everybody was slammed. So that was a real challenge for all of us, and it was certainly hardest on those working in clinical capacities. But I've had so many opportunities trying to address homelessness and finding services for homeless patients who were ready to be discharged from hospitals. The only alternative at one point in time, way back when, was sending them to Skid Row in Los Angeles. And so what we did through the Hospital Association and our 501c3, the National Health Foundation, is set up a recuperative care program that is still going strong today and gives hospitals the ability to transport patients to a safer place with care and the recuperation that they need before they go back out to where they live, unfortunately, which is on the street for many of them. Well, when I was interviewing for the job, they asked me if I knew what a GPO was, and I said no, and that's where I was going to go work. So I actually, for you students, I had to ride my bike to the library to look up what a GPO was, because this was before the internet. So I figured out what it was. It was a group purchasing organization. So that's a way of saying I have moved into positions, and I think this is important for the students to understand. I've moved into positions where I haven't been qualified, but I have demonstrated the ability to get that to that level quickly. And I think so you need to have, for students, the confidence to know you have the ability to do things and to take opportunities as they're presented, even though you may not feel like you are ready. So don't shy away from opportunities that present themselves. So I went into that GPO role, and then I moved into the association side, more on the advocacy piece, and one of my mentors at the association at the time had an opportunity for me to go out and become a regional vice president in our inland area. And he said, Mark, I know you're not ready for this, but I want you to go out there and to learn. One, he said, if you're out there and you make mistakes, it's not going to hit the media in LA. So you're going to go out there, make mistakes, and we're going to work through those, and then we'll see what happens in your career. I think, for me personally, I did several mentorship, or internships, I should say, and internships are an incredible stepping stone towards finding a career path. At a college, I took an internship with with an insurance company. I knew I wasn't going to spend a career in insurance, but it gave me an opportunity to learn management skills and people skills and other skills that I still apply today. So internships are extremely important. I have a teenage son who's a freshman at Point Loma down in San Diego, and we're telling him, you've got to find an internship. You've got to go start now developing relationships with individuals and organizations where you might develop a career, or you might find that that's a path that, hey, I'm really not interested in this. And that's, again, a thing about internships. They're short term, so they could either help you make a change in direction at this point in your education, or it can give you a path forward. So that's why I think internships are so important. Networking is extremely important. Again, I'm here today because of my networking way back when, and I am able to navigate through issues based on a network I have developed over time. And so networking and going to mixers and getting out in the evening to professional events are incredibly important. If you have a young family, they're challenging, but you've got to be able to have that work-life balance. But that networking has got to be an important piece of it. Certainly, American College of Healthcare Executives, Southern California Healthcare Executives, I think is what they're called now. That one is one that I would certainly join if I was in school now, and I joined early in my career. I went onto the board. It helped me learn governance. It helped me learn leadership, and it was also a great place to network. And then they have meetings throughout the year in various locations that if you can attend, it's, again, a great opportunity, and you never know who you're going to meet at one of these events. It may be your next opportunity. Yeah. Healthcare at this point in time is in a place that I have not seen since early 2000s. There were a lot of closures. There was a lot of financial pressure. There was a compression of a number of issues. Some I've already talked about coming down on the industry, and it's not just hospitals. It's also EMS, emergency medical services. It's mental health. It's post-acute care, and so I think we are at a great place to, if we can get, as we get through this, look at our financing system of healthcare. We had Obamacare pass way back when, and we knew that wasn't going to change the mechanisms by which hospitals and physicians get paid. They had some experiments, but hospitals and physicians still are really in a fee-for-service model or a DRG model. I think this generation coming up behind us really needs to push for a value-based reimbursement system, and that's what I think needs to happen to change the overall. Single payer flips the managed money side on its head, and then it manages care where it restricts the care. So it's got to be a combination. You have to have the free market. You've got to be able to make sure that people are able to get through primary care to acute care and then post-acute in a way where they don't fall off the rails, so to speak. Personal experience. I had a mentor, a very close friend of mine still today, and we were having dinner one night, and he said, "Mark, you need to go get your master's." And I don't need my master's. What do you mean you don't need your master's? I've got a career path. I know where I'm going. You don't know what you don't know. You go get your master's. I really don't want to. I'm going to call your boss, and I'm going to make him put it into your job requirement for next year. So I went and enrolled in a master's program, and I got my master's, and so pleased I did. I tend to be a little stubborn, so if somebody tells me I have to do something, I'm not going to do it. But in this case, I'm certainly thrilled I did, and I think today's day and age, the master's may prepare you with an if you're going to go on to a science, or if you're going to go on to research, you need the master's and you need to learn what's in the books. But for me, I got an MBA. It taught me how to think critically, more critically than my undergrad. It gave me the ability to shape arguments differently and to shape what I was trying to portray on paper. So it really helped shape me in different ways that I wouldn't have been able to do if I just kept on the same career path trajectory. I don't use the fact I have an MBA on paper. I don't write MBA next to my name, but I use it here all the time, and I use it in interactions with other people. Yep. So the skills that are important for me are public speaking, writing, negotiation, and interacting with people in a way that does not put them off. So you and I may be sitting across the table from each other on two different sides of an issue, and I'm trying to convince you. I can't start yelling at you and pointing at you and saying, you've got to think this way. We've got to come to an agreement somehow. And so my job is to try and get you there. I also have to understand when I know you're not going to move. And then at that point, I have to come up with a plan B. And so the skills, I think, in addition, so the writing piece is extremely important. And I think there's been less emphasis. I'm glad to hear that Cal State Long Beach is emphasizing writing, because in the people I've interviewed, many of them have not had the writing skills. And so I think that's important. And certainly the ability to speak publicly, no matter what the role is. You as students are not going to figure this out on your own as easily as you could with colleagues and mentors who can help shape it. They're not going to tell you what to do. A good mentor won't tell you what to do unless they tell you to go get your master's like my mentor did. But they're doing that because they care, and they will help you. The good mentors are going to ask you questions, and they're going to challenge you. And so it's challenging yourself, and that's another important aspect here, and I mentioned that earlier. Don't be afraid to challenge yourself. Take opportunities that are stretches for you, and stretch yourself. Don't be comfortable. Don't be complacent. I think there's too much that needs to happen in healthcare, and we need this generation coming out of school now to really get their hands in and come up with some solutions that we've been really grappling with.